Prior to entering the patient's room, I've checked the physician's orders for an ABG. I've verified the patient's chart for any significant findings, make sure they're not on any anticoagulants or I don't need any protective gear. I've also gathered my necessary equipment. I got a towel to put under the patient's wrist, 2 ABG kits in case I need an extra one. I have gloves, my pre-heparinized needle, my gauze, my Band-Aid, my label, and my transport bag. I have washed my hands and I've worn gloves. I'm going to introduce myself to the patient. Hi, my name is Nicole. I'm a respiratory care student. I'm here today to draw some blood from you. Can you please verify your name and date of birth? Okay, thank you. I would then palpate the patient and check for a pulse. I would then perform the modified Allen's test. I will squeeze the radial and ulnar nerve, ask the patient to squeeze their hand a few times, and when I release the ulnar nerve, their hand should return back to pink. It'll be white while they're squeezing, or while I'm squeezing, I mean. Then I would put the towel under the patient's arm so that would help raise up their skin. In my kit, I would also have, which I don't in this one, an alcohol prep pad. So I would clean the patient's area and let it air dry for 30 seconds. I would clean also my 2 fingers. And this glove is too big. Sorry. Okay. So I also have the rubber cap. For an adult patient, you should draw 0.5 to 1 cc's of blood. So I'm going to get my needle ready. I've pulled back to 1 cc. I'm going to take the cap off. Put my hand in the patient's hand. And then I would also check again their pulse. Make sure the bevel side of the needle is up. And I'm going to stick it in. If I got a flash of blood, but if you didn't get a flash of blood, you would have to redirect, which means you would have to find the path of the artery, pull your needle up to the skin surface, move it, and then go back down until you hit the artery and get the blood. I would then pull the needle out and cap it. Put pressure on the patient for 3 to 5 minutes. If they're on anticoagulants, you would need to put it up for 10 minutes. Roll the sample in your hand so that you can mix in the heparin. I would then, after 3 to 5 minutes, put the Band-Aid on the patient. Take off the needle, cap it, squeeze out any excess air, cap it, put it in my bag. Oh, label it, sorry. On the label, I would put the patient's name, their room, their time, the FiO2 setting, the temperature, and the date. and place it on my sample before I put it in the bag. You could have the sample off of ice for up to 30 minutes. After 30 minutes, you would need to put it on ice, and it would be good for up to 60 minutes. I would then check the patient and make sure he's okay, clean up my mess, and put my needle in the sharps container. I would then document the patient's chart and transport the sample, take my gloves off, and wash my hands.